Good morning. This morning we're going to be doing a head-to-toe physical assessment on our patient Ada Slowinska. And Ada came in, she's on a telemetry unit, and she came in with pneumonia. And she is on a nasal cannula for her pneumonia, and she does have an allergy to morphine. So I am going to go ahead and take a label from her chart and put her chart away. I just want to make sure that I'm identifying her correctly. Okay, and then I need to gather my equipment. I'm going to need a pulse oximeter. I'm going to need a thermometer because I'm going to take her vital signs and I'm going to assess for pain. I need my pen light. I have my stethoscope, and then I will have a blood pressure cuff which is in the room, and I'll get my gloves when I'm in the room. Okay, so I'm ready to go in. Good morning.
Hello.
Good morning.
Good morning.
I'm Kim.
Hi, Kim.
Nice
How are
to
you?
meet you. Good. I'm going to be your nurse today.
Okay.
And I just want to make sure that I have the right person. Can you tell me your name
I'm Ada Slowinski,
and your date of birth?
June 1933.
Okay, and your medical record number matches here. And Mrs. Lewinsky, do you have any allergies?
Morphine.
Okay, that's what I have in my chart. I would like to do a head-to-toe assessment on you today, just basic baseline information, and check your vital signs as well. Before I do that, I'd like to know, do you need to get up and use the restroom or
No, I'm
anything?
good, thank you.
Okay, and are you having any pain right now?
No pain.
Okay, very good. I'm just going to close this to provide for privacy. And then I'm going to go ahead and start with your blood pressure and checking your vitals.
Okay.
All right. I'm just going to go ahead and check your blood pressure. My gloves on a minute. Okay, and Mrs. Lewinsky, can you tell me where you are?
I'm at Prairie View Hospital.
Great. And can you tell me what date it is today?
Today, June 29th, 2013.
Very good. Excuse me. All right. Okay, and I know what you usually run, so go ahead and get it at that baseline. Very good. All right. And I'm going to check your temperature and your pulse oximetry at the same time. So I'm going to have you stick that under your tongue. Very good. Put this on your finger, like ET. Just take some nice easy breaths for me with that in your mouth. Great. Okay, you're at 98%. That's wonderful. And ding. Okay, very good. And you're at 98.6. Perfect. Your blood pressure was in normal range as well. Okay, is there any reason I can't shine a light into your eyes?
No.
Okay, very good. So I'm going to just check, make sure your pupils are active. Thank you for taking off your glasses. Okay, and look straight ahead. Very good. Okay. Good. And I'm checking for your consensual response. Very good. And then I would like you to look at the wall. Very good. And now try to focus on my pen. Good. Okay, so pupils are equal. They're round, react to light, and accommodate. You can go ahead and put your glasses back on. Go ahead, smile for me. Wonderful. I'm just going to check and see. Your hair looks great. There's no skin breakdown behind your ears or anything. All right, very good. Next, what I would like you to do is squeeze my hands as hard as you can. Oh, very good. Okay, excellent. And I'm going to feel your pulses. 2 plus. Okay. And your hands are nice and warm. I see you have this IV. Okay. Very good. And now I'm just going to squeeze your nail bed a little bit. Oh, capillary refill is less than 3 seconds, which is wonderful. And then just tell me which finger I'm squeezing.
A little finger.
Okay, very good. And on this hand, can you tell me what I'm squeezing?
Middle finger.
Okay, very good. All right. Now I'm going to listen to your heart, all right? So I'm going to listen in several places. I'm just going to undo your gown a little bit and slide under there. Okay, first I'm just going to listen to the aortic area, pulmonic, tricuspid area, and then the mitral. I'm going to just displace your breast a little bit. Good. Okay, and now I'm just going to take your apical pulse for a full minute. Okay, it's nice and regular rhythm and rate. And now I'm listening for, or I'm watching for the rise and fall of her chest for a full minute. And her respiratory rate is 16. Okay, Mrs. Lewinsky, now I'm just going to listen to your lung sounds. If you would just take a breath out of in and out of your mouth. Good. And again. Good. And again. Good. And again. Good. I'm sorry, I'm going to come over here again. Good. And last time. Great. Nice and clear. Okay. Very good. Now I'm just going to check your abdomen. Okay, any pain?
No, I don't have any pain.
Okay, see a little bruising, but I know you're on that Lovenox.
Mm-hmm.
Okay, it looks good. Good. Oh, good bowel sounds. Very good. Okay, great. Positive bowel sounds in all 4 quadrants. Now I'm just going to gently palpate. Tell me if you have any discomfort.
No, I'm good, thank you.
Okay, very good. And if I was concerned that she may be retaining urine, I'd palpate her bladder as well. Okay, now I'm going to move down. Okay. Now what I'd like you to do is try to push my hands up. Okay, so I'm providing resistance. Good, very strong. Okay, great. And wiggle your toes for me. Perfect. I'm just going to feel your pedal pulses. Wonderful, 2+. Great, posterior tibial, 2+. And the temperature is warm bilaterally. Okay, and then I'm just going to check your capillary refill. Great, less than 3 seconds. Perfect. And don't peek. Which toe am I squeezing?
Little toe.
Perfect. And now?
Little toe.
Okay, very good. Excellent. So you look really good, and I don't see any edema at all. And the color is good, and I just want to check real quick for breakdown. Good. I'm assessing her skin, hair, and nails throughout. Okay, Miss Lewinsky, I'm going to come back up here, and what I'd like you to do, if you can, is roll to your side, and I just want to look at your skin in the back and listen to your lungs, okay? Very good. Okay. Nice deep breath for me. Out through your mouth. Good. And again. Good. And again. Good. Again. Perfect. One more time. And last time. Wonderful. It's nice and clear, and your skin looks great. I don't see any breakdown there. Come on back. That looks great. No skin breakdown. Your lungs are nice and clear.
Thank you.
Okay. Last thing I want to do is just assess, go back, find, I'm starting with you, and I'm going to follow all my lines and make sure I see what's happening here. No inflammation, infiltration to the IV site, and I can see that it is running at the correct rate, and it is the correct solution, and my tubing is not expired. That looks good. And you have your nasal cannula in place, and I can see that that's connected, and it's at 2 liters, which is what the physician ordered. So very good. Now I'm going to put you back down to the lowest position. That pretty much concludes it. I just want to take a look around your room and make sure we don't have any safety issues. I'm going to put this back where I found it and put your phone back. Okay, and you have a pretty clear path to the bathroom. And can I get you anything else?
No, I'm good, thank you very much.
Okay, very good. I'll be back to check on you with your morning medications, and if you need anything in the meantime, I want you to make sure you use your call light and call me. Here it is.
Thank you.
Okay, and pleasure meeting you, and I'll be back,
Nice
okay?
meeting you. Bye.
Thank you. Okay, see you in a while.
Bye-bye.
That concludes our head-to-toe assessment. So what I would be doing now is going to my chart, and I'm going to document the vital signs and my assessment findings, and I will go back and check on the patient then as the day progresses and monitor for any changes in my original assessment.